Hi, this is Dr. Frezza here at the Chiropractic Injury Center in Levittown. Today we're going to be talking about shoulder and rotator cuff problems. This is something that is quite personal for me because when I was in chiropractic school, I had a pretty severe shoulder rotator cuff issue. Right in the middle of school, right, we were learning how to adjust, and my shoulder was hurting me so bad that I thought I was going to have to drop out of school and probably get surgery. I was very fortunate to meet one of the doctors there at the clinic, and what he told me was all of the treatment that I had been receiving, that they were working on the wrong joint. There are two joints of the shoulder that are significant when it comes to these types of issues. So what I'm going to do is I'm going to invite Susan to come into the shot here. This is Susan, our office assistant. Two joints in the shoulder, right? The collarbone is here. There's the AC joint, the acromioclavicular joint, which is out here to the outside. And then there's the sternoclavicular joint, or the SC joint, here on the inside. So what everyone was doing, because my pain was out here, so the standard chiropractic adjustment is to come through and adjust the shoulder this way. Well, they had done that. Thank you. They had done that for several weeks, going into a couple of months actually. And not only was it not getting better, but I feel like it was actually getting worse. Again, very fortunate to run into one of the clinic doctors, and he had said, they're working on the wrong joint. Instead of addressing this outer joint in through here, he said the problem actually is in this closer joint, again, the SC or sternoclavicular joint. So he said, look, if you want this thing fixed, he said, it'll probably take me about 6 months. You have to stop the weightlifting. I think we can get this thing fixed for you. So I did exactly what he said to do. He was right. Inside of about 6 weeks, the pain went away. But the bigger issue was he wanted to actually get the joint fixed. So again, that did take about 6 months. He stabilized it for me, and I was able to make my way through chiropractic school and graduate and do all of those things. I always took that lesson with me, and since I've been in practice now for the past 20 years, I've had a lot of patients who have come in and have similar type issues. So we've been addressing and fixing these shoulder problems, again, these SC joint shoulder issues, for an awfully long time, and we're getting some pretty good results. The thing that is necessary when we embark upon this is to make sure that patients give it enough time. Again, it took about 6 weeks for me to feel better and to stop exercising and give it ample time to heal, usually somewhere in the 90-day span for it to heal completely. So again, this video is if you're someone who has these chronic shoulder or rotator cuff issues, if you've been going to the medical doctor, if you've been doing muscle relaxers, if you've been doing shots, if you've gone to the chiropractor or acupuncturist and you're just not getting the relief that you feel that you need, you should come on into the office, let us take a look, let us diagnose the issue and see if it's not the wrong joint, see if it isn't really that sternoclavicular joint. Again, most times, in my opinion, it is. We can get it fixed for you. So again, you're welcome to come on in and make an appointment. Dr. Frezza here at the Chiropractic and Injury Center, and thank you for your time in watching this.